Hello, good morning. My name is Julio Chavez. I'm from the Moffitt Cancer Center in Tampa, Florida. It was a randomized clinical trial comparing a bispecific antibody called Mosunetuzumab plus an ADC or antibody drug conjugate called Polatuzumab versus Polatuzumab and Rituximab. So the idea was to assess the response of this combination in patients with high-risk diffuse large B-cell lymphoma that had relapsed at least after one line of therapy. So the study enrolled 80 patients, 40 patients each arm, and we saw significantly higher response rates in the Mosunetuzumab and Polatuzumab arm in comparison to Polatuzumab and Rituximab alone. Also, the duration of response, the duration of complete response was better, as well as the progression-free survival. So this study actually responded to several questions. One of the questions was, first, can Mosunetuzumab be given safely as a fully outpatient regimen? And it was, as opposed to prior Mosunetuzumab studies, the Mosun administration was subcutaneous, and that led to lower cytokine release syndrome, which is a common toxicity with bispecific antibodies, and also lower or essentially non-existent neurotoxicity. So about 10% patients had any type of toxicity. So it was fully outpatient. That was kind of like one of the most remarkable things, other than the efficacy. So I think this is a regimen that should be considered for patients with aggressive B-cell lymphoma that don't have access to CAR-T now that we have approval for CAR-T in the second line, but many patients cannot access because of distance, logistics, and hospitalization. Still, community doctors are not very comfortable giving a bispecific because of the high rates of CRS that I still you see, even though majority of our low grade CRS. But in this case, we have very low rates, like a 10-12%. So I think that was kind of like the most remarkable.